Hey, it's Dr. Mike here, board certified chiropractic neurologist, here to discuss the newest patient case study. We're going to discuss her symptoms and what we found, neurological finding we found, and what we did to start changing it. So if this is your first time to the page, please hit subscribe below and share with everyone, like it. Just trying to help spread the word on how we change neurological findings. These are functional neurological findings. Obviously, all the patients that we're dealing with here have had imaging ruling out any serious vascular damage or infarcts to different brain areas, so that we can really start changing the brain a very healthy way, not concerned about anything serious like that. So let's go right ahead and jump into the case. Patient presents with constant neck and shoulder pain for the past 15 years. It has gotten a lot worse. She says she's had it longer than that, but the last 15 years it's gotten pretty unbearable, to the point where she sees a chiropractor every 3 to 4 weeks to get adjusted, and that seems to keep it at bay for a while. She states she also has some dizziness. She states when she wakes up in the morning, she will have the dizziness. She'll feel like she is spinning, and what she'll do, she'll get a hot pack or take a hot shower, and that'll kind of go away in the morning, and then she's good for the rest of the day. She states she also gets 1 to 2 headaches a week. They feel like it's behind the eyes, and they feel like it's pulling back like that. And she states with the shoulders, it's really tough. She feels like she has limited range of motion, and she can't lift her arms. She feel like her arms get stuck trying to go up just like that. All right, that is her symptoms. Obviously, we took her vitals. We checked all of those, heart rate, blood pressure, all that stuff. That looked really good. So what we did was we put her in the diagnostics. What it does is it puts you in these goggles where we're recording with infrared cameras. We're recording your eyes, and the way I do it is I have it set to where there's a room view, and then you can also see the patient's eyes. So the patient's in complete darkness. We can see her eyes, and then you can also see what we are doing with the patient and what I am doing if I'm doing something with the patient to try to change any neurological findings. Okay, so what we found with her as soon as we put her in the goggles is that she has a left beat nystagmus at rest. So she's sitting there, and her eyes are drifting, slowly drifting to the right and coming back like this, and it's at rest. So she has a left beat nystagmus at rest. We know that is an abnormal neurological finding. So what we do is we try to change it. First thing I tried was I had her look to the left with her eyes. She has gaze evoked nystagmus when she looks to the left with her eyes, whereas her eyes drift back to center, and it was really tough for her to hold an end gaze. And then I had her come back straight, and I was like, well, did that change that nystagmus at all? Didn't really seem to slow it that much at all. She still had that left beat nystagmus at rest, so I'm like, okay, let's try the next guy. So what I had her do was turn her head to the right and hold it over there for about 10 seconds. And then I had her come back straight, and that seemed to start slowing it a little bit. So I was like, okay, there we go. It slowed it, but it didn't stop it. So I was like, okay, let's do that again. So I had her turn her head to the right, and I actually resisted the range of motion. So we did kind of like an isometric contraction to the right side, and she held it for about 10 seconds. We came back straight, and that seemed to stop it for about 5 to 8 seconds. And I was like, that's a good enough window for me. We were able to make a positive change in her neurological finding. And so that is what her neurological finding was, and that is what we did to change it. Now let's talk about why we did what we did. So what I'm going to do is I'm going to mark in red the areas that I deemed were increased firing. Remember, we're looking at the vestibulo-ocular reflex predominantly right now. And I'm going to write the areas that I deem are kind of increased firing, and then we're going to talk about what we're going to do to increase the firing of the opposite, right? So if someone has a left beat nystagmus, her eyes are drifting to the right, okay? So that means the muscles that make your eyes go to the right, they're increased firing. So our eyes are drifting to the right a little too much. So we're going to do too much is in red and then too little's in blue. And the blue is what we did for treatment, what our options are. The red is what we're deeming as abnormal. So if she has a left beat, her eyes are slowly drifting to the right. So the muscles that make her eyes go to the right, which are involved with the vestibulo-ocular reflex, the areas that controls those are firing a little too much, okay? The other thing that's firing a little bit too much is the left horizontal canal. So we would say on the left side, this guy right here is firing a little bit too much as well. So that guy's firing a little bit too much as well. And with the left horizontal canal being at increased firing, what it would do is it pushes the eyes to the right. That's what the left horizontal canal is in charge of with the vestibulo-ocular reflex, okay? The next thing we're going to look at is the neck muscles that turn your head and make your eyes go slowly to the right. So those would be any neck muscle that turns your head to the left, okay? So any neck muscle that turns your head to the left is increased firing, right? So it'll also turn your head to the left. So you got all these different muscles that you want to take into account, but in reality, all of those are kind of as a group, and the area of the brain that controls those are increased firing. So now we got all the three different ones that we're looking at that could contribute to an increased firing of the vestibulo-ocular reflex, causing the eyes to drift to the right, okay? So here's what we tried. The first thing we tried was we tried to have her look to the left, because if her eyes are drifting right and the muscles that make her eyes look right are increased firing, we're like, well, let's increase the firing of the opposite. Let's strengthen those guys. So in the area of brain that controls those, so we make her look to the left. When we made her look to the left, let's use blue. So let's say these are decreased firing, so we want to make her look that way. All right, so we're having her look to the left, and we tried to see if that would improve her finding. When she looks to the left, she has gaze-evoked nystagmus, so we know the area of the brain that holds her eyes to the left isn't very strong. So we did that for 10 seconds. We came back straight. Didn't really fix that nystagmus, so we're like, okay, let's try another one, see if we can have a greater impact on changing that finding. So what I had her do was I had her turn her head to the right and hold it over there. So she's turning her head to the right. So we had her turn her head to the right to try to increase the muscles in the area of the brain that turns your head to the right. So we're looking at all those muscles that turn your head to the right and trying to increase the firing of that, and that actually slowed a little bit. I was like, all right, but it didn't stop it. So what we did was we tried to make it a little bit, have her put a little bit more effort in to work that area a little bit harder. So I actually gave her resistance when she turned her head to the right, and that actually stopped the nystagmus. Got to remember, anytime you turn your head to the right or to the left, you're going to be using your vestibular system too, because they're all interlinked. You can't separate the three: your eyes, your inner ear vestibular system, and your neck. So whenever we turned her head to the right, we're actually also increasing the fire of the right horizontal canal as well. So we're kind of doing double whammy, and that seemed to stop her nystagmus. Important to note was during the exam, when we saw that she had her eyes drifting to the right and beating to the left, she had a left beat nystagmus. Things we didn't do was we didn't do things that would make that worse, right? So it's important to know things that have the potential to make things better and things that have the potential to make things worse. Like personally, I would never have her turn her head to the left, because I know that the areas that cause her eyes to drift to the right are the same areas that would involve her turning her head to the left or her eyes looking to the right. And I know there's a very good probability that if you increase the firing of those areas even more, you are going to make that nystagmus worse, you're going to make that neurological finding worse, and that's the last thing you want to do with your patients. So during our exam, I never had her turn her head to the left, and I never had her look to the right, because I know that those areas are already firing too much. And so that's why we avoided that, and we always start with the ones that are probably firing a little lower than they should be, and we try to balance things out. We strengthen the weak, and we go from there. So what we did that. Patient reported 2 weeks later she came back for a follow-up visit. I put her back in the goggles. Her nystagmus is almost completely gone, and she's probably had this for many years. And all I had her do at home was turn her head to the right multiple times throughout the day and hold it over there with her eyes closed, and kind of like aggressively hold it over there, not just like going through the motions. And she noted that her neck tone was the less it's ever been. She doesn't have any more dizzy episodes. Her shoulders, she can actually move them a lot better without problems. And she says she also has more energy. So it's like, it's really cool that whenever we just start changing that subtle neurological finding with just a simple head turn, she started having all these profound effects. We know that if we get the sensory motor systems of the brain working the right way, the rest of the areas of the brain get to do other jobs and get to work a little bit more efficiently. So that's what we did with her. If there's any questions, leave them in the comments below. If you've seen this before and done something a little bit different and changed it, put that down there below too. I'm always looking for different ways to change things and help better myself and to help people more and help my patients. But that's the case, and if you think this could help anybody, share it with them, especially kids that are coming up or people that are professionals that are using this kind of technology. I think it's really important, one, to be able to see things, and two, be able to try to change it. Try to change it. Put them in the goggles and try to change what you see. I think that's so important that we don't really do too much of or enough of. So keep that in mind, and Dr. Mike is out. Hope you enjoyed this one, and I will see you next week.